Good morning to you, Norman.
Hi, Lisa.
I must say there was a deep intake of breath when we heard that news about the 2-year-old.
Yeah, this is a very rare event, but it just shows you the dimensions of the current pandemic on the East Coast. I mean, I don't know what the statistics are. It's very hard to say what the statistics are in terms of a normal, healthy 2-year-old boy dying, but let's assume, for example, it's 1 in 10,000, maybe even higher than that. Now, if you've only got a few hundred cases of COVID around, you're not going to see a 1 in 10,000 event, if that's what the statistics are. But when you've got thousands and thousands of cases every day, that's when you do see these incredibly rare events. And we just forget that we're in the worst year of the pandemic in Australia. We think it's all over. It's not all over, unfortunately. And unfortunately, at the moment, 6-month to 5-year-olds can't get immunised. It won't be too long, hopefully, before that becomes possible, but they can't at the moment. I think that what happened with this child, at least according to the reports, I've got no inside information, is that the child presented quite late. Or when I say quite late, that's not to blame the parents, it's just that it was late in the event. And I mean, it is possible for paediatricians to use the treatments that are available for COVID in children. There's lots of drugs that are used in children, what's called off-label, which haven't been clinically trialled when it's tough and you're fairly desperate. But I suspect it was too late for that in this child, although they may well have tried. So for parents watching, it's incredibly rare, and if a child does get sick, you do need to actually go and seek medical advice early, and if a child is getting very sick, it is possible for the hospital to use these drugs off-label, even though there's not much experience with them if things get desperate.
Yeah, well said, Norman. I'm sure those words would be a great comfort to many obviously worried parents out there this morning. Now, we do know that the death rate across Australia is falling, so much so that Victoria, for a couple of days recently, has recorded no deaths. Can we read anything into that?
Well, it's great news. It's a sign of very high vaccination levels. That's what's saving us from this Omicron, which is not a mild virus. Vaccination turns it into a mild virus. It's the unvaccinated who are still getting disproportionately affected. Just look at Hong Kong, 1 in 200 people dying with COVID-19. It is a virus that's as severe as the Wuhan virus, and just be thankful for vaccination. What we're seeing, just remember though that with BA2 coming in, we're seeing another peak, and we're going to go, we're in a really very short frame Big Dipper at the moment. We've got over BA1, now we're on BA2, but the worry is where the next variant comes from and how severe that is and how much it evades the immune system. Let's hope we're well protected moving forward for new variants, but we are vulnerable moving forward, but be thankful for what we've got now as we go into the next lull.
Yeah, and look, honestly, when we look at what's been before, did any of us imagine, and here we are 2 years to the day since announcements were made that we were going to go into our first lockdown tomorrow. 2 years ago it happened. Has it rolled out as you thought it might, Norman?
I don't think anybody can say that they predicted it. I certainly didn't. It was, you were going from moment to moment. The week before we went into lockdown was not a good week. We had a basketball match in Western Australia with thousands of people going. We had 250,000 people going to go to the Grand Prix in Melbourne, and we had the Sharks game, the Cronulla match on the Saturday night at the same time as we were being told to socially distance. I think that what we were saved by were the state premiers who pushed the federal government into much severer restrictions than the federal government was comfortable with, and that really got us through that first wave very well and got us to zero spread in many parts of Australia. So it was a really good thing to have done on the back of closing our borders, which was a federal government initiative, I think in late January. That was a really good thing to have done.
2 years, Norman, does it feel sometimes to you like 20?
I can barely remember what happened yesterday, much what happened 2 years ago. So you can call that my cognitive decline or the state of the pandemic.
Oh, hardly. I think it's more the state of the pandemic.
Yeah. Norman Swan, thank you for sort of nursing us through it over the years, because your insights have been invaluable. Appreciate it.
Thank you.